Goa, our favorite tourist destination, is fighting a tough battle against coronavirus and is struggling to save lives. More than 70 COVID-19 patients lost their lives at the Goa Medical College and Hospital, the state's biggest COVID facility, in just 4 days. Officials said that the deaths occurred due to logistic issues in the supply of medical oxygen. The Goa government told the Bombay High Court that the recent deaths occurred due to a delay in replacing oxygen cylinders, as they did not have an expert tractor driver capable of transporting the tractor with cylinders in a small pathway in reverse gear to unload it. Well, this is as shocking for me as it is to you. The grim situation in Goa has exposed how unprepared the state was to fight a deadly pandemic. The GMCH has a capacity of 708 patients, and as of May 14, the hospital had more than 950 patients. Patients without beds were accommodated on trolleys and had to be administered oxygen through loose cylinders. The positivity rate in Goa has increased at an alarming rate since late April. Compared to early March, when the positivity rate in the state was around 7%, the same positivity rate shockingly crossed the 50% mark by end of April. What does this mean? This means that 1 out of 2 people in Goa were testing positive for COVID-19. The positivity rate has now dropped to nearly 30%, but the situation still remains grim. Some blame the civic body polls that were held in April for the rise in infections. Others blame the state's careless attitude towards COVID restrictions. Not just that. When the country was staring at the second COVID-19 wave, especially in neighboring states like Maharashtra, Goa was open to all and allowed gatherings on beaches and markets. Complacency, no restrictions, and people traveling in large numbers from across the country to Goa around Diwali and New Year's together worsened the situation in the country's tourist state. And now, the state is paying the price as authorities rush to respond to the health crisis. State's health minister in an interview had said that everybody in Goa was taking things for granted and no one was following social distancing. The state government decided to impose restrictions from 21st of April and is currently under a full lockdown till 23rd of May. The Travel and Tourism Association of Goa, which had earlier opposed any kind of curbs on March 19 and had said that making testing mandatory for tourists was not a solution, changed its decision only on 7th of May and asked the government to impose a lockdown. Several state ministers were of the opinion that restrictions on tourists would kill the industry. As the cases spiked, the same ministers called for a state-wide lockdown. Amid all this chaos, it took a High Court order for the government to make testing mandatory for those entering Goa. Why did the state wait for the situation to get worse? Several reports suggest that the state's health minister and the chief minister are at loggerheads for difference in opinions. Chief Minister Pramod Sawant has said that there is no shortage of oxygen in the state and that the crisis is due to mismanagement in getting the oxygen to the hospital. But the state health minister is of a different opinion. He says that the chief minister is misinformed. While the politics over a health emergency continues, who is paying the price for such criminal negligence? Unfortunately, it's the people. People who are now struggling to find a bed, medical oxygen, and other crucial medical facilities. To take control of the situation, Goa now plans to use the anti-parasitic drug ivermectin to treat COVID-19, a drug that is not proven to be effective against the virus. In fact, the World Health Organization has warned against the use of this drug, but the Goa government has decided to distribute it anyway. Even as hospitals in Goa see a surge in cases, the scenes at crematoriums are equally disturbing and gut-wrenching as bodies continue to pile up. Behind the shocking numbers is the tragic story of Goa's hospitals stretched beyond their capacity, logistical hurdles such as lack of drivers to supply oxygen trolleys, lack of governance and attention. A state that hardly reported any infections in the first wave is witnessing a nightmare in the second wave. A disaster that was waiting to happen in a state overcrowded with tourists, no safety measures, and an ill-equipped healthcare infrastructure has claimed many lives. Politics over deaths in Goa shall continue, but the tragedy and the negligence cannot be ignored. And this negligence is criminal.